Hello everybody, I'm Chris Edwards, I'm the Accountable Officer for Barnsley Clinical Commissioning Group. As part of this AGM to look back at the year 21-22, we'd just like to really celebrate the magnificent efforts of staff and partners during the second year of the pandemic. It's been a particularly challenging year, but everyone's really risen to the challenge. It's been a year of sadness and hope. It's been a lot of sadness as COVID's continued to affect our lives and affect our services. But there's been a lot of hope this year as we've had a vaccination programme, a really successful programme, and also a booster programme that we had through the autumn and winter as well. And there's been new treatments for COVID as well. So what we've seen is a lot better outcomes for people who've gone to hospital with COVID. As all this has been happening, all the other health services have continued to run. Staff have worked tirelessly and continued to adapt to find new ways of working to try and keep providing services to Barnsley patients. Inevitably, there will be some backlogs, there'll be some waiting times, and next year our key priority will be about tackling backlogs and trying to keep waiting times as low as possible. Even during the pandemic, we still managed to do some new developments. So one development was a new facility at the Glassworks in Barnsley, which will be available, easy to access for Barnsley patients, for blood tests, for diagnostic tests and screening. So this year will be the final year of Barnsley Clinical Commissioning Group. After 9 years, very successful 9 years, we'll now transfer over to the South Yorkshire Integrated Care Board. And I'd just like to thank staff past and present, governing body members, GP practice members, and also a big thank you to our chair, Dr. Nick Balanch, who's seen the CCG through all those 9 years. Thank you.
Hello, I'm Dr. Balanch, Chair of Barnsley CCG. Welcome to our annual general meeting. This year's AGM will be the last as the CCG transitions into the Integrated Care Board and new place-based arrangements. I thought a brief look back at some of the work of the CCG over the past few years would be appropriate. The CCG is a GP practice member organisation, including every GP practice, and it was representing a proportional influence based on practice patient list size. This had a direct governance connection to frontline clinicians and through Patients' Council and patient reference groups, the involvement of the public, a unique arrangement in the history of the NHS, empowering those on both sides of the front line to take part in decision making. It blended clinical, professional and public leadership and influence. So I'm going to go through some of our achievements just to remind us, really because on many occasions we were well ahead of others, often several years ahead. We have something called a practice delivery agreement, which was an arrangement to invest in practice resilience and sustainability, and that's where we were facing, and still face to some extent, a workforce crisis and shortage. We have Barnsley BEST, Barnsley Education and Support Time, a protected learning initiative that brings together primary care, community and secondary care to share in professional development. One of the most popular and one of the earliest protected learning initiatives in the country. We have a GP home visiting scheme, and that was partially related to workforce issues and GP capacity. The home visiting scheme does some of our home visits, so GPs can free up more time to spend with patients in the surgery or calling them. Some of you will be familiar with My Best Life. This is our social prescribing scheme. When we set this up for the CCG, it was several years ago, and to some degree it was a leap of faith, and it was many years before it was mandated to have social prescribing. We're very proud of My Best Life, and it's helped improve the quality of many people's lives. One of the things I'm most proud of is the clinical pharmacists. That was a unique scheme that the CCG developed, and in that, clinical pharmacists are based in practices and help with prescribing and medication issues, improving the quality and safety of prescribing. Get Fit First, some of you will have been exposed to this. This was one of the earliest in the country, again, acceptable health optimisation schemes, advising people on lifestyle changes to optimise their health prior to any operations in order to decrease risk. As a GP and chair of the CCG and a member of the GP Federation, you would of course expect me to talk a little about the GP Federation. The GP supported the establishment of this and the iHeart brand, which many of you will be familiar with because it delivers the out-of-hours services in Barnsley. The Federation has also supported the sustainability of many of our more vulnerable practices and has managed to help those practice services in some localities be sustainable and keep going. Over the past 3 years, the CCG has worked with the GP Federation and with other partners, and collectively we've massively contributed to the COVID vaccination programme, which has prevented many people being ill or even dying. But also importantly, what people sometimes forget is that staff have also benefited from that, and as a result of not having COVID, have been able to continue to work on the front line. Married with the Federation is our single primary care network. This was a change in the GP contract which was mandated upon us. Barnsley has the largest primary care network again in the country with 6 geographic localities. This allows patients and the structures of service delivery to benefit and reap the benefits of local sensitivity, but also the at-scale organisational support. The CCG has always, of course, played its part in system working and leadership, both at Place and at South Yorkshire and Bassetlaw and more latterly South Yorkshire. We've championed the development of integrated care. Other system working that we're particularly proud of is supporting the Health and Wellbeing Board and contributing to the 2 priorities, one of which is early years intervention and support, and the other is mental health and the development of the mental health partnership, which was so badly needed. And through all this, we've been rated as outstanding for the past 3 or 4 years. We came runner-up in the Health Service Journal CCG of the Year. We've maintained financial balance, met all our organisational and statutory requirements, and above all, the CCG has been a place that we can be proud to say people have been happy to work in and to move to work in. So thank you to all. First of all, to all our current and previous staff, all of whom have been fantastic, and some have been specifically inspirational and helped us and moved us on. Our member GP practices, our system partners, of course, and most of all to the Barnsley public who've supported and challenged appropriately some of our changes, some of our interventions in our efforts at putting Barnsley people first. Thank you.
Hello, I'm Roxanna Naylor and I'm the Chief Finance Officer at the CCG. I'm here today to present to you the accounts for the year 21-22. The CCG entered the year with significant financial pressures as a result of the continued impact of the global pandemic. The financial framework introduced by NHS England at the start of the pandemic continued to allow NHS services to deliver care that was responsive as a result of the continuation of the impact of COVID-19. I'm pleased to report that the CCG delivered financial balance with a surplus position of 1.6 million at the end of the year. We also met the requirement to maintain our running costs within our allocation. We increased investment into mental health services and the Better Care Fund, which is the work that we do with the council. Here's a look at the financial position. The CCG received in total funding 531 million. This can be broken down into the following areas. Programme services, 482.4 million. This is the funding to commission services for the people of Barnsley. This includes our hospitals, ambulances, community services, mental health services, contributions to the councils, prescriptions and some primary medical services. Primary care co-commissioning contracts, £43.4 million. These are the contracts held with GP practices to provide primary care services. CCG running costs, £5.2 million. These are the admin costs associated with the commissioning of services. So where did we spend the funding we received? We spent £279.4 million on hospital services, including ambulances. Mental health services, 43.9 million. Community services, 55.6 million. Continuing healthcare, 30.4 million. prescribing £49.9 million, primary care services £56.8 million, other programme costs £5.1 million, running costs £4 million, COVID-19 costs £4.3 million. Our total spend was £529.4 million. To put this into context, here's how we spend each pound received. 53p in every pound is spent on hospital, ambulance and patient transport services, 8p on mental health services, 10p on community services, 6p on continuing healthcare, 9p on prescribing, 11p on primary care services including national GP contracts, 1p on other programme services, 1p on CCG running costs and 1p on COVID-19 costs. As the CCG moves into 22-23, we continue to work with partners across Barnsley and the integrated care system to deliver care in line with the requirements of the NHS long-term plan. The work will continue as we transition to create the South Yorkshire Integrated Care Board. There continues to be a significant financial challenge. However, partners remain committed to using the funding it receives to deliver and improve the care for the people of Barnsley. Thank you for listening.
Over 500,000 COVID-19 vaccines have now been given to Barnsley residents. This is the biggest vaccination programme we have ever seen, with vaccine clinics running across the borough. It has been a huge joint effort and Barnsley has had really high vaccination rates as a result. Hundreds of volunteers came forward, turning out in all weathers to put people at ease and making it as smooth an experience as possible. In December, the Barnsley GP vaccination service set up home in Barnsley Metrodome. With the arrival of the Omicron variant, thousands of people took the chance to get their booster vaccine ahead of the Christmas and New Year. We want to say a massive thank you to everyone who has supported the vaccination programme. Whether you've worked or volunteered in a vaccine clinic, or if you've stepped forward to get your vaccine, you have made a difference. We have seen several positive programmes put into place for children and young people to support their mental and emotional well-being. This has been a priority this year for the CCG and the Barnsley Health and Wellbeing Board.
So, hi, I'm Chris. I'm a peer mentor at the Barnsley Home Wellbeing Hub. The Home Wellbeing Hub, home stands for helping our mental health, missing the H because it's Barnsley. To me, the home is about creating a safe space for people and enabling them to talk openly about their feelings and any issues they may be having, whether it's in regards to their personal or mental health. As a peer mentor, my role within the hub involves working alongside the staff and the young people in making it a bit easier for everyone, and if the young people don't necessarily feel too comfortable talking to staff about certain issues, they can talk to me about it. And for a lot of the young people, I've recently been in similar situations in the last few years, so I can help relate to the situations that they're in.
The hub is a safe space for young people like me. It lives up to its name as home. It's home away from home, especially when things might get hard or stressful. And the staff in the hub probably saved my life a few times and are really helpful. And basically it's just a place for young people to be themselves and just live as who they are. And there's different activities and and things to do, like you can make coffee or you can make a masterpiece of artwork.
I would hope like what Chili Pep did for me, they really helped me when I was in a really bad place, and I've now got the opportunity to help other people. I would hope that if they got the support they needed and things improved for them, that they will then be able to take that experience and use it as a learning opportunity to then provide the same support to other people and create a chain of people helping people that just goes into the future.
We know that for older people in particular, longer stays in hospital can lead to worse health outcomes and can increase their long-term care needs. During the pandemic, we needed to ensure that anyone needing hospital care, for whatever reason, was able to be discharged in a timely way. Where people are medically fit for discharge and do not need to be in hospital but may still require some aspects of care, services are provided with short-term funded support to be discharged to their own home.
When we set Discharge to Assessor, we wanted it to be a real collaborative piece of work, working with our partners out in community and social services. It's a really good service. What it aims to do is get patients home first, so back into their own environment, because we know that that's better for patients. Patients always do so much better when they're at home rather than in an acute bed. Now we're managing to get patients home on the same day as they're medically safe to leave hospital, which has real benefits because that decreases the length of stay in hospital and that makes sure that they're in the right environment. And then we provide assessments on that day of discharge, and then we put care and support in as needed to be able to maintain our patients at home in a safe environment.
This year we secured funding for a new NHS Community Diagnostic Centre. It brings high-tech healthcare directly to the heart of Barnsley. The centre is run by Barnsley Hospital and is inside the new Glassworks retail and leisure space in the town centre. The service will help alleviate pressure on existing NHS facilities and will be open 7 days a week. It is a convenient way for people to receive things like ultrasound scans, x-rays, breast screening, blood tests and bone density scans.